So we've seen quite a few people over the years, and currently seeing clients who are dealing with spondylolisthesis. And then we've had a few new clients call in recently as well, asking if we help with spondylolisthesis. So I thought it'd just be helpful because it's bombarding us in all these different avenues. You know, if we go over what it is and then how we can help it. So if you hear squeaky toys going off in the background, by the way, my dog decided to playtime now.
Same goes here. If you hear dogs barking.
Yeah, he's going all over the place right now with squeaky toys. It seems like every toy that he has, like the squeakier it is, like it's coming out to play right now. So with spondylolisthesis, like what it is when you have a fracture, you know, of a part of your vertebrae called your pars interarticularis, and essentially what that is, it's the part of the vertebrae that connects the body of it, so the part that we kind of think like the spinal column's made out of, with the segments that interlock with each other. What happens is that fracture of the part where the vertebrae attaches, where each vertebrae interlock with each other, it causes the body of the vertebrae, like the thicker part, to slide forward. And you can have different grades, like grade 1, 2, 3, 4. So grade 1 is slight slippage, and then 2, 3, 4 progressing along is more slippage. So, and it's something that when that happens can impact like compression of the vertebrae on the discs, can impact compression of the nerves that come out of the spinal cord through the spinal column and into the rest of the body. So how we help that is we really first help the client learn to identify where are the factors that are leading to the spine being put in a position where that can happen in the first place, and then essentially treat or undo those mechanisms, and then work on stabilizing the spine in general. And one of the biggest things actually goes right along with like the herniated disc talk. It's a great segue because, you know, if there's forces such as the pelvic deviation, so if the pelvis, for people out there, you know, your pelvis can tip forward, backward, or it can do two different things from left to right because it's two separate bones to make up your pelvis. So if there's a forward tilt, what that's going to do is it's going to excessively curve your lower back and then cause an excessive forward, stimulus on the spine that can lead to this happening in the first place. Same thing with the upper back, Chrissy, like you're talking about. If the upper back is tight and rounded, then the lower back has to overextend too to keep the spine's dynamic S curve. And that can then place too much pressure or stress on the lumbar spine, which typically where spondylolistheses happen, and cause that that fracture, then forward slippage of the vertebrae. And there's some people out there, it's interesting enough, who have them and don't even know it. They might not even be causing pain. So yeah, it all depends on the mechanisms that lead to it that determine the level of pain or why you're feeling what you're feeling. So, and then like if we talk about pelvic deviation or upper back deviation, the knee and the ankle can play just as big of a part, right? Because it's all connected and the body works as units. So if the ankle is unstable, then the knee's gonna be unstable, then the pelvis gets deviated, spine gets stress placed on it. So, it could be that we need to work ankle stability and ankle range of motion to help neutralize somebody's pelvis and get it out of that tilt, to then help put the spine in a position where it's not just being forced into that excessive, extension, causing the forward slippage. So yeah, it's something that we help a lot of people with, like herniated discs, but it can be a completely different driver for, people coming through the door.
Did you find with these new clients that their symptoms were something that happened over time that gradually got worse? Or do you have any people that ended up in this condition because of some impact or accident or anything?
Good question. Yeah, it could be either. It could be like an acute event, so like an automobile accident. If you get hit from behind and then causes that excessive forward movement of the body. Typically, it's more of a chronic thing. Like just over time, these mechanisms place that incremental stress on the spine until this starts to happen. It gets too stressed and then fracture, then deviation occurs. So more of like the chronic side of it. Yeah, it typically people start having pain and then it's like, it's just like low back pain, like we all get.
Yeah.
Or like life, as you get as you get older, and the kind of things like you get told, right? As you're you get older, it's because you're getting old, because I'm tight, whatever. But essentially it's the improper mechanism, no matter your age, what you're doing, it's the improper mechanisms that lead to that lower back getting stressed. So your body starts giving you warning shots as symptoms. So even like a low back pain, your body's telling you, hey, something's up in that area. This area is getting overworked, overused. And then, over time it keeps getting worse and people get an MRI or an X-ray, and then, it gets diagnosed as a spondylolisthesis. And the scary thing about it, because I think like spines are scary. I think we're kind of taught like it's such a complex area that, anything at the spine's like, ooh, like let's not mess with that. But fusion is actually one of the biggest suggestions that get tossed out there. I know a lot of people call us because they don't want to do a fusion or they want to avoid that at all costs. Pretty involved procedure, and oftentimes if they have to go through the front portion, so your abdominal, the anterior portion, and then fuse it from the back. So it's more than just fusing the spine, and when the spine does get fused, it's not going to move anymore. So that creates a whole other slew of issues surrounding that fusion of excessive movement of the spine, which can actually lead to other spondylolistheses happening.
Yeah.
So that's one of the things that drives a lot of people to us. So it can heal. Your body can change as long as you stop the mechanism that's causing the injury, the condition, to perpetuate in the first place.
To your point too, like about it being so scary when you hear a diagnosis that comes.
Yeah.
Something about like it has something to do with your spine. I had a client and she didn't have a great experience with the doctor, and unfortunately we've heard stories like these before. They're not super common, but they come up where sometimes a doctor looks at an MRI and X-ray and like their reaction to tell you is like, I can't believe you're not in more pain, or I can't believe you're still walking. Like
you have the back of an 80-year-old, right? And they're like 40. You hear that a lot too. It's like,
exactly. Actually, my last client, the herniated disc, he was told that his MRI looked like he was 60 years old. Like the language around sometimes around diagnosis, it can be super scary. So just something to keep in mind if you haven't gotten an MRI or an X-ray yet. Keep in mind that you want to go in just to get information. You're collecting information to find out what's going on in your body. And this is something I tell my clients when they do ask me, like, I'm considering getting an MRI, I'm considering getting an X-ray, because I want to know what the inside looks like, which totally makes sense. I think the more information, the better. But I do kind of try to prep them that way, and just to remind them, like, your body. We're just getting a picture of the inside. Please don't be scared if it does come back like you do have a herniated disc or a spondy or whatever the case may be. Like, what you're doing to fix it. Like, you're here. We're gonna do this together, because unfortunately it can be made to feel really daunting and like a much bigger deal or scarier issue than what it has to be.
Yeah, understandably. So you're not broken, you're not weak, you can heal, kind of things that a lot of people feel, when they're diagnosed with these things, or, kind of told, like you said, Lisa, in terms of all that stuff. So, yeah.
I had a client that was told, like, if your disc slips any further, like, you're going to lose complete control of your bladder.
You could be paralyzed. Right?
Yeah, you're going to be paralyzed. Like, I can't believe you're still walking. And so I literally saw her, I think her first appointment was the day after. And her whole demeanor from the first phone call we had, which was like the week before, to meeting her for the first time right after she had that appointment, her whole demeanor had changed. Like, I could sense the fear, and she was like so concerned and so worried, rightly so. But once we started to get her into her exercises, and she got some time to experience how she can create change in her own body, and like for her knowing she's not old at all, like for her knowing that even within a couple decades she's had a pattern that's in her movement pattern that's led her to this place, that she can retrain her body and undo those patterns. And it's going to take the effort, to commit and do it consistently and stick with it. But since she was seeing and feeling changes right away in the right direction, she was like, I'm sticking with it. So
yeah, absolutely. No matter your age, your previous experience, if you're over 60 or whatever, you still have the same muscles you did when you're 20. They're designed to work the same exact way, but as we in our modern world, right, we just don't use them all, and our bodies are designed to use them all. So, right, like you said, just it's the improper mechanics of the movement pattern that lead to it. So let's train all these muscles to work together as the unit that they need to, and allow the body to heal.
Yeah. Do you guys see a lot of spondies, Chrissy?
I worked with a few, and I think that Matt hit on a lot of good points, and you as well. Like the approach of being like regional to global. I feel like with symptoms like this, it's so easy to zoom in and like want all the answers on that one spot. And then you come to us and we're like, let's zoom out and look at your posture. It's like, because really the body is created to work as a unit. And so I do feel like if we do zoom in too close, then we can miss something that can be so obvious. And spondy and even herniated discs, a big piece of that too is like using the symptom, but as a means to understand it instead of letting it become a problem or your identity. And part of that takes time, in the process of healing, and you're turning over a new leaf. Like you are breaking a cycle. So it is like everything from mindset to movement has to change, and it doesn't take overnight. You know what I mean? It is a slow progression, and even little wins, like little gaps of awareness, realizing like unbiasedly watching yourself move, being like, wow, I do load my right side way more, or I only carry my purse on my left side. Like these little nuggets are like actually big in the Egoscue world, like in life. They're big pieces that can steer you into more of like a functional approach to wellness versus like this fear, or just being scared of the pain.
Yeah, you got the process, right? The training of the muscles, it takes time, but if you're addressing the root cause of it, it's going to lead to a more permanent outcome of relief at the end, rather than just chasing symptom or like managing symptom.
Yeah.
Yeah, you're right. When you get that symptom focused, you miss out on the root cause of why it's happening. Right? What's the rest of the body telling you? Love it. Great point.
Especially if you're dealing with like an A to P disparity, right? Like you touched on, like it can be something so small, but like that disparity, your body can be so used to that, and that's so comfortable.
Yeah.
And let's say like your daily activities only keep that going, whether that's driving with the right foot or opening the door with the same hand, like you can be doing all of the right things, and things are still continuing unbalanced because you're not addressing the root.
One of the biggest things we see is people's glutes not working. You're not firing efficiently. Your butt muscles not firing efficiently, that lead to herniated discs or spondies because it's not controlling the position of the pelvis. The glutes keep your pelvis even from the backside. So then that causes the pelvis to tip forward, like we were talking about, and the spine just to take the brunt of the force. So yeah, like the solution can quite simply be getting your butt in gear.
Yeah.
Yeah, get those glutes working.
MIA.
Yep, that's right. Yep, that's right. So yeah, and when we meet, with people, that's our big thing. Like we were talking about, we just help you discover, these root mechanisms, like why this is actually happening. Give you the knowledge of what's going on. And then show you how you can heal. So